I would like us to talk about physical exercise and what the most immediate benefits would be. How could someone start from scratch? Someone who does no exercise at all in a practical way, which is something I think we are also failing to communicate.
To give you an idea, this morning I received a type 2 diabetic patient who is completely sedentary. So I explained to her that I don't need her to go to the gym to do 1,000 things, that I need her to walk. And I asked her if she knows the concept of insulin resistance. And she tells me that yes, she knows it. So I tell her, well, I want to tell you that walking, activating the leg muscles is a free, super effective and very simple method to improve insulin sensitivity. That is, to combat insulin resistance. So I said to her, look, I need you to start walking every day. So suddenly she said to me, oh, doctor, but it turns out that I'm afraid to go out to the park because it can be dangerous or something like that. So I asked her, between the door of your house and the back of your house, how many meters could there be? Then the husband who is there says about 25 meters. I tell her, well, if you walk those 25 meters inside your house, in the end, you are exercising. So I was telling her, look, the first thing one has to do with the doctor, with the patient, regarding how to start exercising is to set a realistic goal, because it is important to understand that within what we call constitutions, suddenly a patient, for example, who is a fast oxidizing vagotonic loves sports, but a slow oxidizing vagotonic hates sports. So I have to understand that I cannot, according to the patient's constitution and metabolism, ask them to do an exercise load that they will not do. So I have to first find a realistic level, which is what I am going to propose, and then basically it should not exceed their limit. So I cannot tell this lady to start walking 1 hour a day. No, she had to start with 10 to 15 minutes. And I told her that as she did it, she would move to 20, then to 25, then to 30, and so on. And that at the moment she reached walking an hour, we would be doing an extremely wonderful exercise. Additionally, as in the bioimpedance test, it was clear that she has a state of cerebral hypoxia. In fact, she has a situation, because it must be remembered that if there is one organ that is clearly affected in diabetics, it is the brain. So this exercise was going to improve her cerebral perfusion and to help them become aware of their physical condition, to take into account the concept we call functional rhythm, that is, how I can progressively improve them as days or weeks of exercising go by, and how to start especially with easy, low-intensity exercises, and also help them create a fun routine. And for example, I insist a lot. In fact, I have them here on my desk. I insist a lot on the resistance bands, because sometimes, for example, if I am here at the computer reading, I take advantage of it. And while I read, I do this. So I always show patients that I have one of these resistance bands in my bag, and that while watching television, while doing a number of things, one can be using the bands to do muscle toning work, because people sometimes only focus on cardio and forget that toning is also necessary. So it is about showing the patient the benefits, and I almost always take out a photograph from a paper that shows how 35 degenerative or chronic pathologies are directly related to sedentarism up to this point. Surely, in a few years, more information will come out regarding this, and in that way, we send the patient home thinking they need to exercise, they have to move. I think that is something super important to keep in mind.
Yes, I agree with everything you have said. Perhaps one of the immediate benefits that can be observed with exercise is the emotional state. Irritability decreases, things that can even be measured on the same day, right? Because sometimes there are, let's say, habits that are more medium to long term, and it can be difficult to motivate oneself. But if the person already feels that immediate benefit of their state of relaxation, of mental clarity, then they can value it. Sometimes I am frequently asked, well, how quickly does walking help? One way I usually mention is walking, where you can talk with the other person, but with some difficulty.
I mean, you can talk, but yes, that would be clear. Yes, that is true. And that is something I always tell them. If you are doing an exercise and you are going to talk to someone, you practically can't, because you are out of breath. You are above your capacity. So that one can talk, that it shows they are fatigued because they are doing, I mean, that they are active, but that they are not short of breath. This is very important to keep in mind.
The other thing is the muscular aspect that has been talked about for a long time, but now with more emphasis, the importance of muscle mass also for healthy longevity that we should work on from now. Let's talk a little more about that, and if it can be something practical that the attendees could incorporate, in addition to what you have said.
There is, above all, a very important aspect, and that is, let's say, for men, for example, to understand the importance and role that muscle tone, and muscle mass have, for example, in what can be their sexual life. When a male patient comes to me, for example, and tells me that he has a little or sometimes some difficulties with erection, etc., I always ask the question, for example, if in the morning when he wakes up, he has involuntary erections. So if the patient tells me no, that when he wakes up in the morning, it's an envy, I say, well, okay, notice how you have the ability to make a choice. Now, what is happening? How long has it been since you went to the gym? How much sports do you do? How much exercise do you do? And that is when you find that the man who goes to the gym and more than just doing cardio, lifts weights and does dynamic tension exercises. Remember back in the days when the concept of Charles Atlas was born, when there weren't the machines and equipment that exist today, but it was simply based on the strength one developed with their own muscles, how it can be done, that today calisthenics has come back into fashion, right? And there you can perfectly find on Instagram in many things where they talk about exercises with your own weight, with your own body. And then is when all these bands appear to hang and do exercises. Because the truth is that jogging or walking is very good for us at a cardio level, but it is not effective for muscle. And we must indeed remember very well the presence of those very famous molecules, the myokines. It is true that just as there are adipokines, there are myokines, meaning molecules that are secreted or produced by the muscle itself, and many of them play a very important role in the psychoneuroimmunoendocrine network. Because then if we think about the action of doing cardio, plus weight training and exercises with dynamic tension, and exercises with TheraBand and things like that, it increases or balances the function of the psychonetwork, the neural network, because then the sympathetic parasympathetic balance will start to function better in the psychoneuroimmunonetwork. So, undoubtedly, the ability to maintain a balance between TH or TAA will be much easier if I exercise than if I do not exercise. I will have a much more active TH. I will be able to defend myself better against infections and aggressions. And finally, psychoneuroimmunoendocrine. So, really, exercising is not only important for the vascular part, but by working on the muscular part, we will allow network medicine, which is what the foundational concept of integrative medicine is now called, to enable all the systems that are clearly interconnected to function in an ideal manner. It has also been discovered that depending on the type of exercises, there can be more neuroimmune effect, more neuroendocrine effect, or more psychoneuro effect. For example, when you do Tai Chi, which is a technique that we all know, that wonderful dance that the Easterners do, there is an impressive psychoneuro activity there. Now, when I do techniques like Pilates, many of the different ways of exercising allow us to act more on one or the other. Now, when I simply move my body, I act on all four networks. Exercise is not just a simple activity. It plays a significant therapeutic role in our lives. It is essential for enhancing the quality of life and overall health well-being. Regular physical activity is known to offer numerous benefits, including improving mental health by reducing anxiety and depression. It also boosts physical health by enhancing cardiovascular fitness, strengthening muscles, and increasing flexibility. Moreover, exercise helps in lowering